Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. The two doctors will first give us an update of the COVID cases and also HA situation. We start with Dr. Zhang. Good afternoon. We recorded 1,721 local positive cases, including 610 PCR positive cases recorded locally, and also RAT positive cases successfully declared online and confirmed via PCR, 1,171 cases. We also have 139 imported cases, including 104 positive cases confirmed directly via PCR, and also 35 RAT cases confirmed via PCR. Cumulatively, we have 1.21 million plus cases since the fifth wave. We did not record any death case, so the death count since the start of the fifth wave remains the same. And I will now defer to the HA to give you statistics about HA. We have 552 confirmed cases in the HA hospitals with 100 new cases. For those requiring isolation facilities, 188 patients are in isolation wards, 13 are in second-tier wards, and 158 patients are in North Lantau Hospital, Hong Kong Infectious Control Center. And there are also 81 new cases. As of yesterday, we did not receive any new report on critical cases. There are also 2 more cases in serious condition. Among the inpatients, there are 10 patients in critical condition and 11 in serious condition. 2 critical patients among them at the moment are receiving intensive care in the ICU. In relation to recent cases, these patients mostly have stable condition with mild symptoms. As for the admission figures, there has been a slight increase comparing to a few weeks ago. But in terms of the number of severe cases or cases in critical condition requiring intensive care, we haven't seen an increasing trend, and the situation remains stable. As mentioned by Dr. Zhuang, as of yesterday, we have not recorded new death cases. Now we have 139 imported cases, 67 picked up at the airport, including 63 cases arriving on the 23rd of June via 15 flights and 4 cases arriving on the 22nd of June by 3 flights. There are also 57 cases picked up at quarantine hotels and 15 other cases identified after they've left the hotels, with the majority of them carrying higher CT values. Some had lower CT values. They could be local cases. As for residential care homes today, there are 4 residential care homes. The first one is Chung Wah Group of Hospital, Fang Wah Wun Tai Nursing Home. We reported 1 case on the 18th of June with some residents sent to the quarantine. At the time, we reported the cases on the first floor. Now on the ground floor, there are 2 staff members, and altogether 9 cases recorded in the past 2 days. The residents have already vacated the homes, and we have been identifying more cases. The other case, Hong Wei Ho Sin Hang Ging Lo Elderly Home, involving 2 residents and staff members on the second floor. Other residents will be sent to quarantine, as well as some staff members. Chongling Ya Yun. The third home involves 2 residents, and residents living on the same floor will be subject to quarantine as well. There's another case, Fu Tai Wu Lei Ono Yun. That's another home which recorded 1 case, and now we've seen some more cases. And at the time, some residents have been sent to quarantine, and now more residents will be sent to quarantine. Altogether, some 40, 50 people, including residents as well as some 10 staff members. They'll be sent to quarantine. Cumulatively, we have recorded 8 residents and 4 staff members as infected. In one of the cases, It is suspected to be BA.2.12.1, and this will be mentioned again as one of the relevant clusters. As for schools, we reported 199 positive cases. 96 of them were reported this morning, and 103 were reported yesterday afternoon earlier. And 199 cases involves 164 students and 35 teaching staff from 163 schools, including 29 kindergartens, 59 primary schools, 72 secondary schools, and 3 special schools. In the past 7 days, 83 schools recorded more than 2 cases involving students or teachers. Today, we have advised the following school and the class in this school to suspend face-to-face teaching, and that is 聖約翰白約翰會督中學, the secondary school. In this secondary school, there are 29 students in class 4C, and for this class, face-to-face teaching will be suspended for 1 week. As for two schools, we previously advised them to suspend classes, and that is the basketball team of St. Francis Xavier School. The students involved would have to be isolated, and another case has emerged from the same basketball team. So altogether, we have recorded 12 cases. As for St. Stephen's College, the 52 students in the dormitory are now in quarantine, and 1 student have become a confirmed case, and there are altogether 10 cases on the same floor. As for subvariants of Omicron, for imported cases BA.2.12.1, we recorded 208 cases. For BA.4.5, we haven't recorded new cases. For local cases, suspected BA.5 or .4 cases, there are 5 such cases recorded. One of the cases is an 86-year-old female who lives with a person arriving in Hong Kong on the 10th of June from Indonesia, and for the 9th day specimen on the 10th, the specimen tested positive. This lady and the Indonesian did not leave home, and after this Indonesian tested positive in the 9th day specimen, the 86-year-old female was sent to quarantine and later admitted to hospital. She is in stable condition for the time being. The second case related to an imported case is a 3-person household related to a Malaysian who arrived in Hong Kong on the 12th of June, and for the 12th-day specimen on the 28th of May, the specimen tested positive. They did not leave home, and at the moment, the household of 3 have become confirmed cases. There is also another suspected BA.4.5 case, 49-year-old male living in Sunway Village in Yuen Long, and works for the Gunjung coach service. Basically, he drives visitors to hotels, and he is subject to regular testing. On the 21st of June, he tested positive. He's now in isolation. So this is a BA.2.12.1 suspected case. Because of his work nature, he wears full PPE whilst on duty, but there may be instances during work when he might have taken off the gown and might have had some kind of contact. As for BA.2.12.1 suspected Omicron substrain cases, we recorded 21 more local cases. As for the Victoria Harbour restaurant, we have recorded 7 more cases involving patrons to the restaurant, and there are also 3 close contacts of these cases which have been confirmed. So altogether, we have 33 patrons and 4 close contacts who have been confirmed, and they range the age 6 to 69. Between the 19th and 22nd of June, they started to feel unwell, and they involved 20 males and 13 females. Now, we checked the vaccine pass record, and we understand that there are some 270 patrons who visited the restaurant on the same night, and they will be subject to compulsory testing. And I suppose they are doing testing at the moment.
And yesterday we were at the premise of the restaurant and we took some environmental samples and they have all proven negative. Apart from these cases that I've mentioned, there is another suspected BA.2.12.1 case, which is related to previous cases, and that is a case living in Potin Mansion, positive in the quarantine. And there are 6 cases without sources, and 4 of these cases, family members are suspected of BA.2.12.1 infection, including 1 living in Tuen Mun, Block 10 of Yut Wu Villa. And the wife is also in the quarantine center. It is a positive case, and there is in Aberdeen Pick One estate, and also there is a Tin Shui Wei Tin Lai estate, and also Hongyi estate P block, and basically this is a case in a positive case, plus the 3 family members of this case are also positive cases. In the past day, there were 61 cases recovered, 54 released from hospital. The 5th wave till now, there are 51,520 cases that have recovered and 21,147 patients already released from hospital. Since 2020, there had been 63,900 recoveries and 63,527 released from hospitals. And for in-hospital screening, there was 1 case found positive, and the same room patient is listed as a close contact. 24,021 staff members infected, and 23,825 of them have already recovered and returned to their work positions. Q&A time. Please introduce your organization before you ask your question. The gentleman at the back there. Greetings, Hong Kong 01. First of all, about the 2 government officials, Mr. Eric Chan and Mr. Eric Zheng. Do you know the source? Where were they infected? Were there variants? Were they sent to the quarantine center? Other officials who are close contacts, did they have any private gatherings? And because of their work, perhaps, would there be arrangements for them to that is to exit their quarantine because of the work nature? That is, well, I will not disclose individuals' infections situations. The next question. Now TV. Greetings, doctors. Yesterday, the 2 government officials have been, the secretaries have been infected. What kind of clusters are involved, please? And also the Tuen Mun Harbor restaurant case. What is the ventilation for this restaurant? All 19 environmental samples are negative. So is there any further information you can provide for this cluster? For the Harbor Restaurant cluster, the EMSD experts have gone to the premise this morning. Actually, I have not received the report yet concerning the ventilation of the site. As for the seating of the cases, at present, we do not have all the information about the seating. We know that some are seated in the center and some at the more inside of the restaurant. The gentleman at the far back.
RTHK. So first, I would like to ask about 2 top officials have confirmed infected with COVID-19. So how would the CHP assess the COVID situation in Hong Kong leading up to July 1st? And second, we'd like to ask more about the Victoria Harbour cluster in Tuen Mun, the restaurant cluster in Tuen Mun. So has the CHP identified the source of infection, and can you give more details as to what are the infections risks in the restaurant?
For the restaurant in Tuen Mun, we suspect there's an outbreak in that restaurant affecting, I think so far, let me check. So far, 33 patrons of that restaurant and 4 close contacts of the patrons were infected, and they were suspected to be related to BA.2.12.1 Omicron variant. And we have taken 19 environmental swabs yesterday, and so far they're all tested negative. I understand that our EMSD colleagues has inspected the place this morning, so we'll observe what they have found. I will not comment on individual cases.
下一題，前面中間嗰位女士。
The lady in the middle. Greetings. I just want to know about the Bong-on Old Age Home. It's just been mentioned that there are cases in the ground floor. I would like to know what is the transmission chain. Is it because of contaminated facilities? And also, before evacuation, have the cases come into contact with each other? And also for Fu Tai Old Age Home, it's just been mentioned that there is an infection of BA.2.12.1 subvariant. Is the case an old age person, a resident, or a staff member, please? Now, as for the Victoria Harbour restaurant, do we know the distribution of the tables or seating, please? And also for the Hing Tai estate, would that be, or the 2 cases concerned, are they super spreaders, please? Your first question, which old age home were you referring to, please? For Form 1 Woon Tae Home, home for the elderly, there are staff members who are working on both floors. So there is a possibility of some transmission there. And the first floor, for the previous cases, there are no new cases reported. But for the ground floor, there are cases, and some of the staff members have been affected. And the staff members, some of them will be working on both floors. So we will have to look into this. And about Fu Tai elderly home, the case is a resident, not a staff member. And also for the Victoria Harbour restaurant, we do not know the source. Next question, please. At the back, the gentleman over there. Greetings, cable TV. About the Harbour restaurant, for the new cases and the existing cases, were they at the restaurant? Were they patrons at the restaurant on the same day at the same period of time? And there is a 49-year-old coach driver working at Kwun Chong. Before confirmation positive, where was he? At certain restaurants, or where did he go to? For this driver, he ordinarily wouldn't be going around a lot of places. Basically, he would go to work and get off from work, and going to work in taking lunch. He would have takeaways, and he would be eating in some open space areas. And from time to time, he would go to certain restaurants, but they would be like Café de Corals and the like.
全部都係同一段
Yes, these cases occurred after 6 p.m. on the 16th of June, the same period of time. Next question, this lady in front.
And the Morning Post. We would like to know if there is a growing cluster in the government headquarters and how many close contacts are identified. How many are actually working in the government? Thank you.
I will not comment on individual sporadic cases.
下一題。
Next question. This lady at the back. I'm from Ming Pao. First question. What is CHP's view or definition on close contact? If they wear a mask and have a meeting at the same time, are they close contacts? And how long should the exposure be before categorizing them as close contacts? And for every case, would you retrieve the vaccine pass record to check the movement records? And under what circumstances would a place be subject to CTN? And about elderly homes, for full-time elderly home, my question is, can you tell us more about when the cases occurred? Dr. Zhang referred to a resident being the first case in this home, and what's the source of infection? What about the case under the BA.2.12.1? Is this case a resident or a staff member? And also for a pregnant woman, if upon admission screening, she tests positive, should she deliver in an isolation ward, and what is the difference in terms of delivery process? For close contacts, usually we're talking about household members or starting 2 days before the case started to exhibit symptoms, the persons who have had contact with that confirmed case without wearing a mask or had dinner together. And for full Thai, the first case involves a resident. And for the suspected BA.2.12.1 case, this case is also a resident, but we have seen more cases involving staff members in recent days. So we need to conduct analysis to find out the source. In light of the epidemic situation, all expectant mothers upon admission screening would be subject to nucleic acid test, and if the test result is positive, the patient will be arranged to stay in isolation facility for clinical observation. And depending on the patient's needs, suitable support will be provided, including analgesics. The speaker is not coming through. The speaker is not using a microphone. Well, that's an exception if there is an outbreak. Usually, for mask-on activities, the persons in contact would not be regarded as close contacts. Next question, this lady here. I'm from Economic Times. I'd like to ask about the 86-year-old female suspected to be BA.4.5 case, and also the two-person household. Is it an oversight of this imported case leading to infection among the household? Because for these two cases, you said that the household members did not go out and about much. So is there a need to tighten the anti-epidemic measures for arrivals to prevent importation of cases? We need to conduct further investigation. We are not ruling out the possibility that these might be imported cases with longer incubation period, or perhaps the specimen taken during the case's quarantine could not get an accurate test result. Whereas for majority of the imported cases, they're either picked up at the airport or at the quarantine hotels. So I would say this only constitutes a small percentage. Next question. Good afternoon. I'm from In Media. Now, is there a high risk of an outbreak among the top echelon of the government? And what is your assessment of the risk level? I will not conduct any risk assessment on individual cases. Are there any other questions? If not, that's the end of the press briefing. Thank you.